Hello, Dr. Dave Webster, and this is the fourth video in a series where I'm asking you, the viewer, to consider the roles of Cancer Care Ontario and our oncologists, who are the ones in the province most in charge of care of our cancer patients, and then you can decide for yourselves whether they are friends or foes of Ontario's patients. This video is entitled Summary of My 15 Years of Dealing with Ontario's Oncologists. Now, in this video, I'm going to try give you a feel of my experiences and the facts that I've dealt with, so that you can decide for yourselves where their loyalties lie. Is it with their patients, as you would hope, or is it with their employers, Cancer Care Ontario? Now, as a pet expert, I've had a lot more association with oncologists and other physicians because of the many potential roles for pet, particularly in cancer patients. But I've always kind of been a little troubled and confused as to where exactly they stood on the various issues that I was certainly concerned about. And even fewer seem to be concerned about the lack of access to imaging management, which would have been routine in places like Chile and Turkey, and as much as 20 years ago. In my own personal experience, cancer patients are some of the most stressed patients I deal with, and it of course leads to more stress for me. It can be very emotionally draining to be, on one hand, particularly sensitive to their special needs and anxieties, but at the same important time maintaining the proper professional perspective so that they can make the most appropriate management decisions for these patients. Yet, in fact, I've really met only one, possibly two oncologists who I would say had reached a reasonable balance on that. Now, I first would explain this lack of empathy as just a coping mechanism because they were dealing with a lot of situations where many of these patients would die during their management, and this can be upsetting, of course, as I've said. But next they wondered, well, maybe they're more detached because these patients were often part of a drug trial, and the oncologists need to be more detached so they could make unbiased decisions about the impact of this drug on this patient, and so on. Yet, over time, it became impossible to dismiss their lack of concern for the standards of management of their patients and what they didn't have access. And in my experience, none of the oncologists I have ever dealt with are the least bit concerned that Ontario patients have the least number of PET scans per 1,000 population of anywhere on the planet where PET is available, or that up to 90% of the scans that are performed are the exact opposite of the world expert body of opinion. Now, like me, however, that on a daily basis they see the negative impact this has on patients. But even more disturbing was their utter lack of concern with respect to the absolutely unprecedented and disturbing accusations made against Cancer Care Ontario by Canadian and international medical experts, and going back as far as 2005. In addition, they also understood that decisions based on PET were not in any way based on science, but simply based on a political agenda. And then finally, the realization that Cancer Care's only response to repeated challenges by me is to threaten my privileges if I dare to continue to inform physicians and patients about how Cancer Care Ontario has assessed PET. Now, in fact, I can think of only one oncologist over the years who was in fact very disturbed and upset about his lack of ability to use PET appropriately to manage his patients, that he was seeing his colleagues at renowned centers of excellence in cancer management around the world were using on a routine basis, and had been doing so for many years. He was a radiation oncologist. He just returned from an international meeting, and he came to my office very frustrated, angry, and upset. And he said to me, why should I even bother going to these meetings? And he'd realized that in his working life he would never have access to anything more than pretending he was living in the 1990s. But most importantly, he truly understood the serious impact, negative impact that this had on his patients. So here it is, 7 or 8 years later. He's now retired, but not a thing has changed in Ontario. Yet I have yet to deal with a current second oncologist to this day, radiation oncologist, who is the slightest bit concerned about this major discrepancy between how PET is used in radiation oncology in the rest of the world versus Ontario. So I'll now relate to you a couple of my experiences that have helped me over the years to come to my conclusions, and you can make out of them what you will. But one particularly memorable experience was a very memorable and interesting gentleman who was a local prominent businessman, unfortunately diagnosed with colon cancer. On his original workup, his CT and MR exams had shown that he had masses in his liver, but the radiologists had reassured everybody repeatedly that these were benign masses, not to worry. However, he was followed up, of course, with serial CT scans. They were growing and obviously were cancer, and so 6 months after the original diagnosis, he was now finally started on chemotherapy. But that had finished, and it was winter coming, and so he and his wife were planning as usual to head off to Florida. As he lived in Ontario, he could only be assessed with a CT, and therefore it was done before he went. Now, the radiologist's report was unequivocal. He stated that the treatment had failed, and what this meant for the patient was that effectively he was terminal. This news was utterly devastating to this very close-knit family and this man, and he made plans to close his business. They weren't going to go to Florida, and he basically was getting ready to die and getting his affairs in orders. But in the meantime, a friend had told him about PET scanning and the roles in colon cancer, so he went to his oncologist. And even though the patient was going to pay for his own scan, he had to argue with the oncologist to get him to sign the requisition so that he could obtain one. So he got the scan, and what it showed was that, in fact, the masses seen on the CT were not cancer. The FDG PET showed no uptake of glucose, demonstrating limitations of just CT scans, and in fact, the treatment at these sites had been successful. But what the scan also showed, and nobody would have known about, was that he actually had a new 1.5 centimeter cancer in his liver, which even in retrospect, looking at the CT scans again, the radiologist still couldn't see. He discussed this with his surgeon in Toronto. They didn't think it was a big deal. They said he didn't sell his business. He went off to Florida, and while he was down there, he paid for his own gamma knife therapy. This was a very big deal locally, and it was on the news. And so another colon cancer patient who's 48 had been also told by his oncologist, and again based on the CT, that he was terminal, and to get his affairs in order, he stopped work and was just basically waiting to die. Now, he'd seen this, and so he went to his oncologist, and even though this man's wife was a nurse in the oncology department, she herself had to argue with the oncologist, who she worked with on a daily basis, to convince them to sign the requisition to get the PET scan. He did get the PET scan, and what it showed was that he was far from terminal. In fact, he only had one cancer active in the right adrenal gland, which was in fact successfully removed at surgery. Now, unfortunately, neither of these patients would have any further PET scans, and complete lack of concern by their oncologists, and within a couple of years they both died. But as far back as 2005, the medical literature was clear that if you compared patients followed only by CT, as we see in Ontario, versus PET CT, that at 3 years down the road, you had a 60% greater chance of surviving if you were followed with the PET. Now, I in fact met a patient from Quebec who had colon cancer. He was originally diagnosed at stage 4. This should have been terminal normally, but I was talking to him 10 years after his diagnosis, and yes, he had been followed with PET scanning. Now, we'll never know what the fate of my patients would have been had they been allowed access to PET here in Ontario, but I think it's fair to say they probably would have survived longer. So here it is, 2018, so it's the current situation. At least 50% of colon cancer patients with possible metastasis or recurrence are not eligible for a routine PET scan. Yet this is of no concern to the Ontario oncologist, and the million-dollar question remains why. But not long after these episodes, my own oncologist locally reported me to the chief of staff. The reason was that I had been putting appropriately in my nuclear medicine reports about their patients that consideration should be given to getting a PET scan. The upshot of this was I was no longer allowed to make what was the most appropriate recommendations for these patients in my reports. Now, in other videos I've made, you can look at, I've described the absolutely surreal experience of being in oncology rounds where everyone in the room, with the exception of the oncologist, agrees that clearly the patient needs a PET scan that we are discussing. Instead, the oncologists come up to me after the meeting and keep telling me that I must not, criticize or contradict Cancer Care Ontario. Now, in closing, I'd just like to give you a particularly shocking experience of a patient that was shocking to the patient and certainly to me, and was really quite upsetting. This was a breast cancer patient, and she was quite excited at first because she was being referred to one of Toronto's most prominent breast oncologists, physicians, and researchers. But she'd heard about PET, of course, and so naturally she asked this physician whether or not she should get a PET scan. And what he said to her was this: if she was to get the PET scan, and if it showed that she had more disease than he'd expected, he would refuse to treat her. But why did he not want this woman to have a PET scan? quite simple. He would be aware that staging cancer patients like this breast cancer patient, and she had been staged, if you're just using CT and MR, on average they are wrong 30% of the time. And unfortunately what PET scans typically show is that the patients actually have more disease than you expect, meaning that they have a worse prognosis and thus require different and sometimes more aggressive therapies. So why didn't he want to know? The answer is as simple and brutal as this. He was running a drug trial. And if he had misstaged this particular patient, it meant that he would have to discard all of his patients up to that point because he may have misstaged them as well. I was absolutely shocked, and I phoned a colleague at the Cleveland Clinic in the States. They agreed the patient needed a PET scan. It was ordered, and I did arrange to have her referred to another oncologist. Now, in my final video in this series, I'm going to relate to you my own disturbing epiphany about Ontario Oncologists and dealing with my own patients. And then when that's all over, you can make up your mind for yourself. Ontario Oncologists, do their loyalties lie with the patients that they treat or with Cancer Care Ontario? And thanks for listening.